Alrighty, we are back with chapter 32 covering rehabilitation and therapeutic modalities. And the last thing we talked about was range of motion. And range of motion is actually included within our therapeutic exercises. So I just want to backtrack a little bit and talk about therapeutic exercises as a whole. So therapeutic exercises are prescribed by trained specialists, and they're tailored to each patient depending on what is going on with them. So it's the MA's role when these exercises are prescribed by the specialist to understand them and then to also encourage our patients, support them, and even educate them about these different exercises. So a variety of these exercise programs are used for therapeutic but also preventative purposes. Some of these exercises are active exercises, which means the patient can complete them by themselves because they can move their muscle and their joints all by themselves. Some of these are passive, which means there's no participation by the patient, but that passive movement is being directed by the specialist or by yourself as the MA. There are assistive exercises where you may be assisting the patient with weakened areas to produce that movement. Or there may be active resistant exercises. And for these, I want you to think that you are actually resisting that movement from the patient. So for instance, the patient may be trying to pull their arm back towards them, and you're going to provide some resistance against it to help improve that movement and strength within that muscle. Here I want to briefly mention electromyography. This is the electrical activity of muscles that can be recorded on a graph to determine how well these muscles are contracting. So different specialists may use this to see what is the muscle potential here. So an electromyography is the instrument used to test the electrical activity of the muscle. They actually insert an electrode into the skin in the muscle to measure the muscle strength. You can also use electrostimulation of muscle. This is where an electric current at a very low voltage is used to stimulate muscles to exercise. So it's kind of saying, hey, muscles, remember how to move, and giving that little volt to do so. It's helpful for patients that have nerve damage to a muscle and cannot voluntarily move the muscle. The purpose is to prevent atrophy. So atrophy is when muscles get smaller, and to also help restore muscle function. One of our therapeutic modalities that we may use, so moving away from the exercises, but actually introducing some therapeutic modalities that patients may use when they're experiencing acute or chronic conditions, would be heat. So heat is very helpful. It actually acts as a vasodilator, so it opens up our blood vessels. It increases circulation because of that vasodilation and helps speed up the repair process. So heat can be used to relax muscle spasms, relieve pain, relieve localized congestion and swelling, increase drainage, because remember we are vasodilating, so we're allowing blood vessels to open up. Increase tissue metabolism and repair, combat local infection, and increase circulation. Heat also acts up to speed up the inflammatory process. So you may want to note that if there is already a lot of inflammation, that it may lead to more serious problems and increase actually the bleeding and the swelling. Heat should not be used longer than it's prescribed. So usually we say 15 minutes on, 15 minutes off, and all heat and ice modalities need to be wrapped, no direct applying heat or ice to the skin. So moving on to cold. Cold is also helpful. Cold, or cryotherapy as it's often referred to, is used to constrict blood vessels or to slow or stop the flow of blood to an area. So this is helpful in inflammatory processes. So if you, let's say, sprain your ankle, there's a lot of swelling, you would want to use cold, right, to reduce that swelling. It can also reduce bleeding. It can also help with pain, kind of working as a topical anesthetic, and it reduces drainage to an area. Here are those precautions for heat and cold. I do want you to read over these because they are very important when we're going to use heat and cold modalities for certain injuries and conditions. I want to mention moist and dry heat because we've talking about heat, but there are different types of heat that can be used. So moist heat, you can kind of think of warm soaks, you can think of a sitz bath, warm wet compresses and packs, or there's even a paraffin wax bath, and that's shown here in this picture. It's actually a warm wax that is applied to the skin. Most of these feel moist against the skin, and they penetrate better than the dry heat modalities. Dry heat feels dry against the skin and does not penetrate like the moist heat types do. These you can kind of think of heating pads or heating packs in these dry heat instances. There are different types of moist and dry cold. So for moist cold, you can think about cold compresses and packs like an ice pack. These often feel moist, or I'm sorry, not an ice pack. Cold compresses and packs. These actually allow the introduction of that cold to the skin and penetrates it better than dry cold. And then a dry cold therapy, you can think about an ice pack. So another type of modality that may be used for therapy is ultrasound. Ultrasound is a high-frequency acoustic vibration that is part of the electromagnetic spectrum. And when I said that, that probably means nothing to you. But what's basically happening is that it's using high-frequency sound waves to convert to heat to be produced in the deeper tissues. This is really effective for chronic pain or even acute injuries like sprains and strains. It can relax muscles, increase elasticity of the tissues, and it stimulates circulation. Usually the treatment lasts anywhere from 5 to 15 minutes, depending on the recommendation of the physician. And here we're going to talk about massage. So massage is wonderful for individuals with certain conditions. Therapists use their hands to touch soft tissues of the patient's body. There are many, many benefits of massage therapy, and there are actually more and more coming out that they've found massage to be helpful for. It can increase metabolism, promotes healing, it soothes muscles, relieves discomfort and pain, and also improves circulation. Sometimes massage therapy can be inappropriate for patients. You can think of patients that have certain circulatory issues and certain conditions that this may not be appropriate for. All right, guys, so this last bit in your PowerPoint, I want you to go back and read the case study and then think through the following questions. Think through what devices would be required for her, what would be important as far as fitting assistive devices, and what other things we could use for support for her. So this is important to think about because remember, every patient is different. Every patient's condition will be a little bit different. So really when we're talking about rehab and therapy, so many different options can be out there for patients. So it's our job to understand those options and find what's best for our patients to help them through these tough times.